So today we're going to talk about melancholy and the real cause. So melancholy is sadness, depression. It comes from the Greek word which means black bile. Now that's pretty interesting, black bile. Well, during the medieval period, melancholy was one of the four temperaments, and that had to do with different behaviors or characteristics. And if you look at more of the temperament of melancholy, you will also get 3 additional symptoms, which gives huge clues on what's actually causing this. We get bloating, we get distension, and constipation. Now, this to me and this indicate there's something going on with the gallbladder. So if you do a search on the gallbladder in relationship or associated with depression, you'll find a whole bunch of data. This is what's interesting. Gallstones, greater risk for depression by 80%. Now, why would someone with gallstones be more depressed? We'll answer that in a second. Next point, removal of the gallbladder can potentially decrease the risk for depression by 20%. Why is that? And low-fat diets, increase the risk of depression. Why? Well, this is why. Fat, especially saturated fat, triggers the release of bile. Gallstones come from a lack of bile. Removing the gallbladder, let's say, for example, there's a bunch of stones in there, and that's obstructing the flow of bile, can increase the flow. So that could decrease the risk of depression by a certain amount. What do all these indicators point to, including all 3 of these? A lack of bile, a bile deficiency. A bile deficiency will cause gallstones. A low-fat diet will also cause a bile deficiency. All right, so now what's the connection between bile and your mood? If you don't have enough bile, you're not going to absorb vitamin D. And vitamin D deficiency will create serious depression. Also, if you don't have enough bile, you're not going to absorb this omega-3 fatty acid, DHA. When you're deficient in DHA and you can't get enough, you could not only have severe depression, but your risk of suicide goes up. So there's a huge connection between the fat that you eat and the fat that is broken down and gets absorbed, getting the right amount of certain fats. And also, because vitamin D is a fat-soluble vitamin, you need bile to be able to absorb it. If you have melancholy or you're depressed, you may need more vitamin D or DHA, but remember, these don't work without bile, so you may just benefit from some purified bile salts. Thanks for watching.
Hey, we're back
With another amazing recipe.
no grains, no sugar, totally keto. There's no suffering in keto.
Absolutely not, Karen.
And it's an immune system builder.
Absolutely. You have to check this
I
out.
think you should hurry up, watch the recipe, and make it yourself. It's just so easy to be keto.
But is it simple?
It's super simple. We hope you enjoy making it as much as we are enjoying eating it.